Good morning, Chairman and committee members. I'm Laurie Boswell. I'm the CEO of Holy Angels in Shreveport. Although we are located in Shreveport, we do serve individuals from all over the state, and actually we care for individuals their families live in the districts we're served by many of you on the committee today. We are a nonprofit that was established in 1965 by the Catholic Diocese, and we continue to serve today as an independent nonprofit focused on our legacy and serving a broad spectrum of individuals. 180 individuals, about 100 of them live in the community, in community homes, but we have about 80 who have complex behavioral and medical needs. And so we are a quality-focused organization with excellent programs tracking hospitalizations, the reasons for ER visits and hospital visits and stays, and trying to avoid that at any cost. We also are an organization that is focused on community integration, and we have many programs where we serve people who live in their home in the community. Rather than go through all of the great programs that we have, I'd like to focus on our medical care for a moment and to tell you about Caitlin. Caitlin's story is one of a young person who came to us from the neonatology unit as a baby and stayed with us until she was 22. Caitlin was severely disabled with cerebral palsy and blind. She suffered from continuous and severe seizures. And throughout the years, she would go in and out of the hospital, and each time our staff would go. As a matter of fact, those that many times would work their entire shift, clock out after hours, and go to the hospital to be with Caitlin. As her condition really worsened, our director of nursing, who is an ICU-trained RN, found, along with these great direct service professionals, that if we held Caitlin and soothed her, that her seizures would lessen. Finally, she was hospitalized again, and the hospital told us that the end was near, and we brought her back to Holy Angels. That morning at 3 a.m., the nurses called our director of nursing, and she drove in the middle of the night to come there to be with Caitlin. Caitlin died in the arms of a nurse, surrounded by direct care professionals, knowing that she was loved, surrounded by her family. Her family was not an option there. Her mother was incarcerated, and her grandparents had passed away. So we were her family. And I will say to you today that I know that Holy Angels is special because of those direct service professionals and the skilled staff that work there. They remain true to our legacy of excellence and compassion. These are our statewide heroes, and frankly, they really deserve to receive a living wage. And this is part of our mission, to focus on those we care for, and also to be a benevolent employer of those who work for us. The funding is required to maintain this level of care for these 80 individuals who have complexities. We employ RNs and LPNs, but in addition to that, we pay medical directors, internal medicine physician, a neuropsychiatrist, occupational and physical therapist, exercise physiologist, a team of skilled professionals necessary to keep this individual healthy and out of the hospital. So when you think about Caitlin, you can think about the team that served her. Although she came to us as a baby and was 22 when she died, she really looked like she was about 3. She was a child of God and deserves all the care necessary. The tragedy of our story continues. It doesn't just stop there, because in 2008, our reimbursement was cut and never restored. And so today, we are reporting our audited financials last year we lost from operations $1.3 million. The level of Medicaid provided does not cover the care needed. We have a cumulative loss, these are audited losses now, of over $14 million since 2011. So we ask you, why is this occurring and why does it continue? And we ask you to consider funding the services of individuals with disabilities, for these are truly God's innocent children and many of our most critical and vulnerable citizens. We ask, why are they left in this situation? So when I talk about their needs, and I think of those that we serve, it's not just the children who have total care needs, but it's also those who are older, who are aging in place, and I have literally been at the bedside of those while they have passed away. And so when you think about Holy Angels, think of a provider that's efficient, that has a return on investment to the Medicaid system across the state by reducing hospital days and ER visits. Think of a spotless environment, a legacy of love and excellence. And think about Caitlin and her story and the many who are still there and the many who will come after her. We ask you to please, when it comes time to vote, remember this. Remember Caitlin and the many who need this level of care. Remember Holy Angels. Thank you.